doing my health assessment on my sister Melanie, who's over the age of 16. Before we got started, I washed my hands. I had Melanie empty her bladder and change into her gown, and got a full set of vitals. Melanie is 5'1" and 110 pounds, which makes her BMI 20.8, and all her other vital signs are normal. So we'd start out with her head. I'm inspecting the position of her eyes, her ears, everything is symmetrical and in alignment. I would palpate her scalp and her skull, just feeling for any lesions or does anything hurt? No.
Yeah.
Tenderness. Her hair is smooth and appears healthy. She doesn't have any obvious infestation in her hair. I would feel her facial bones and her sinuses, her maxillary sinuses and her frontal sinuses, asking her if she has any pressure. I mean, any tenderness when I apply pressure? No. Okay. We would test her sensation. What did I do with that cotton ball? There it is. So I'll have you close your eyes, Mel, and tell me where you feel the cotton ball, like left or right, and then the area.
Right forehead.
Good.
Left cheek.
Good.
Chin, middle.
Good. So that's cranial nerve 5. Let's see. It seems like that was very short for head. I guess we'll just move on to the eyes. So I'm looking at Melanie's eyes. They are symmetrically placed. Her eyelashes curve away from the globe, which is normal. Her eyebrows are symmetrical, and I don't see any signs of infestation. I would get my pen light, which I don't think I put in my pocket, so I can just use this to make sure that her pupils, you can just look at me, Mel, pupils react to light. They do, they react equally. We can do the cover-uncover test. So I'll have you cover your eye, Mel, and look right at me.
Okay.
And then while you're still looking, pull it away real quick. Good. Can you do that one more time? Okay. And then you can do it with this hand. Yes, please. Thank you. Thank you. So there's no nystagmus, so good ocular alignment. I'm going to look at her red reflex. You can just look just past my shoulder. Yeah. I'm just looking at your optic nerve. Red reflex is just, I would turn the lights down, but anyway, we're looking for red reflex that's in alignment as she's looking straight ahead. I would assess her ears, feeling the pinna. It is firm yet flexible. Asking her if she has any tenderness.
No, no tenderness.
Okay, so yeah, they're aligned symmetrically. So I'm going to look inside her ears. All right, let's see here. Sorry, no. Okay. Good, so her tympanic membranes are kind of a pearly gray. The cone of light in her right ear is at about 5 o'clock. In the left ear, it was about at 7 o'clock. There's no drainage, no excessive wax, no air bubbles behind the tympanic membrane or any redness or swelling. So that all looks good. I would move on to the nose. So just looking at her nose on the outside, it's straight. There doesn't seem to be any like fractures or anything that is amiss there. I'm looking inside at the mucosa, which is sort of a pale pink, moist, nothing draining. The turbinates are up there and they look good. There's no polyps. Do you mind lab pressing, occluding one nostril and sniffing through? Good job.
My allergies.
They're both patent. So I would feel, did I already feel your, oh no, I didn't feel your lacrimal.
No, just my sinuses.
Just your sinuses. Okay, so I'm feeling her lacrimal duct area. Was there any tenderness left? Okay, good, no. So her eyes, we talked about the eyelashes, there's no drooping of the eyelids. She doesn't seem to have any muscular problems there. Her sclera are white, which is normal, just little red blood vessels here and there, which is totally normal. And then can you just like pull down?
Yeah.
Good. So her conjunctiva are pink and moist, and there's no drainage. Lacrimal puncta are present and looks healthy. We'll go ahead and check Melanie's cranial nerves 3, 4, and 6. So Mel, I'll just have you just look at this and then follow it without moving your head, just your eyes. Good job. Good. Okay, so nice smooth extraocular movements, which is good and normal. Trying to think, I'll feel your lymph nodes. Okay, so we'll start with the post-auricular lymph nodes, pre-auricular, submandibular, submental, cervical, deep cervical, supraclavicular. I don't feel any swelling, any tenderness in there.
No.
No. Can you puff out your cheeks and smile and frown and squint your eyes tight, really shut, stick out your tongue and open your mouth and say ah. Good. So since I have her mouth open, I'll go ahead and look in there. Oh, I gotta get my popsicle stick. Where is it? There it is. Okay, so that, having Melanie do all that was cranial nerve 7. So I'm going to just inspect the inside of her mouth. Everything's fine. You can say ala. Good. Her uvula is midline. That and her soft palate rises when she says ah. I can see her tonsils in there. They're about 2+. I can see the pillars in front and behind the tonsils. Her palate is nice and smooth, kind of a pale, kind of a pinkish red. None of her, I'm just going to look at the sides of your tongue. No. Her tongue is normal, has little papilla on it, and the underside of her tongue is kind of bumpy and you can see some veins. Her teeth are in good repair, no lesions on her gums, nice and moist. Her lips are pinkish red and a little bit dry.
Yeah.
But mostly supple and no lesions, and they're symmetrical. So let's see. Oh, I'll have you, so this will be cranial, we tested cranial nerve 12 and she stuck out her tongue. Can you push on my hand through your cheek with your tongue? Good. And this side? Good. So even strength, cranial nerve 12. And then for 11, we'll have her shrug her shoulders and, no, that's good. And then shrug them against resistance. And then, I feel like it's moved head side to side too, but it might not be. We did tongues. I don't know, but I'm not going to spend any more time thinking about. Oh, I forgot to check her cranial nerve. Well, it's 9 and 10 for the gag reflex. So I'm going to put this back there, Mel. Sorry. Good. Cranial nerve 9 and 10 intact. Okay, so we'll move on to the neck. I'm going to feel Melanie's carotid arteries and count her pulse. Doing it on one side then another so she doesn't pass out. Good. Good, she has a nice strong carotid pulse. I don't see any jugular vein distension, which is good. Her trachea is midline. Her thyroid, I'm going to come around here, Melanie, and do you mind swallowing? Good. Her thyroid feels normal. It rises a little bit when she swallows, and her trachea is midline, which is normal. No tracheal tugging. Everything's nice and midline. Just thinking here, what else I'm supposed to do? I can't think of anything. So I'll have you, I guess we could do arms now. So I'm looking at Melanie's arms. Her skin is nice and warm and dry. She doesn't have any suspicious moles. I'll feel her radial pulses. Whoops, sorry. Good, they're equal and strong. I don't see any muscle wasting in her joints or swollen joints. I could do your brachial reflex, but I'll do that later. Can I get at your back now? Okay, so doing the back, I'm going to undo her gown. So first I'm inspecting, I'm looking at her skin. Again, it's warm and dry. I don't see any scars or lesions or masses. She doesn't have any suspicious moles. Her respiratory effort is easy. Oh, let me make sure the camera can still see her.
Oh, yeah.
Sorry. Oh, yeah, it can.
Good.
Yeah. So she doesn't have any problems with breathing. I'm going to check her respiratory excursion on this side by putting my pointers and thumbs near her diaphragm and the bottom of her ribs, and I'll have her take a deep breath. Good. And my fingers diverged symmetrically, so that's good. I guess I'll do I'm going to check her for CVA tenderness. Like going right here, I'm going to pound on your back a little bit, Mel. So tell me if this hurts.
No.
No? Okay.
Nope.
Okay, so that would be, if she was experiencing pain when I did that, that would be a sign of pyelonephritis or other kidney disease, but she didn't have any discomfort. So I'm just going to check your tactile fremitus, which is where I'll place my hands on your back. As you say, every time you hear my hands, just say 99, please.
99, 99, 99.
Good. So I felt vibration equally on all of those areas. So I am going to grab a pen and have check Melanie's, oops, I might tape measure. Check Melanie's diaphragmatic excursion. So if you can just, I think you're sitting okay, Mel. So I'll have you take a deep breath, Mel, and I'm going to percuss down your back a little. Okay, so, sorry that I have to lift up your bra. So I'm just marking, and then you can go ahead and breathe. So take a few normal breaths, and then if you can hold your breath after you exhale.
Okay.
Okay, so I made 2 lines. I just made the line where in the area where it went from tympani to dullness, which is signifies where her diaphragm is. And that distance is normally 3 to 5 centimeters, which is normal, and hers is 3 centimeters. So that is normal. So I'm going to just listen to her lung fields back here, so you can just breathe normally, Mel.
Okay.
Good. Good. Okay, I'm going to come way around here. Okay, so her posterior and lateral lung fields are clear. I hear nice vesicular breath sounds throughout. I just forgot, Mel, that we forgot to do hearing.
Okay.
So I'm going to check Melanie's hearing with first with the whisper test and then with the Renee test. So Mel, I'll have you cover your left ear with your hand, please. And I'm going to whisper a word into your right ear and tell me what you hear.
Puppy.
Very good. And if you can switch.
Table.
Very good. Okay, so she passed that. That's normal that she can hear whisper. I'm going to do the Renee test now, and I explained to Melanie how to do that, so I'll do this side first. Good. And I'll do the other ear now. Ooh. Good. I did instruct her before we started to snap when she didn't hear the tuning fork anymore. So that's a normal finding. Her air conduction is about twice as long as the bone. Okay, so I should have done that with ears, but I didn't. So thank you, Melanie.
Yeah.
Okay, so we did the back of the chest, so now we'll do the front. Oh, I forgot to, you know what I forgot to do? I forgot to palpate back here. I'm just feeling for any anything, crepitus, masses. Do you have any tenderness, Mel?
No.
No, her muscle mass feels the same throughout, so forgot about that. So now I'll come over to this side and feel you up over here. Anything tender?
No.
No tenderness? Okay. So let's see. We will, we could percuss over here. I won't make Melanie take off her gown just yet, but wanting to hear timpani over the lungs, which I am. I will, I guess, inspect your skin. Her color, just as everywhere else, is normal, dry, no scars or lesions or lumps. I'm going to go ahead and just listen. Okay, good. Nice and clear. So let's see, we percussed. I think that's all for the lungs. So for the heart, oh, that was something else I forgot. I didn't listen over Melanie's thyroid and carotid arteries for any bruise, so I'm going to do that now. I do not hear any bruise. So while I have this in my ear, I'll go ahead and listen to Melanie's heart. So I'm looking for the second intercostal space. The apical pulse, good. Pulmonic area is just slightly to the left. Herb's point is down about 1 centimeter. Tricuspid area. Good. And then the apex, sorry about that. Good. Normal S1, S2. And then I guess I would feel for the, sorry, I have to feel your apical pulse under here. Just feeling at the 5th intercostal space, feeling for any rubs or heaves or lifts, and I don't feel anything. Okay, so that's chest, and I think it's time for abdomen now, which you've done before. So I'll have Melanie, hopefully this is comfortable. Okay.
Perfect.
Okay, are you sure? Okay. So first I'm going to inspect Melanie's stomach again, and sorry, I'm just looking for any lumps, lesions, masses. I'm looking for the venous return patterns. I don't see anything abnormal. She's nice and symmetric. Her abdomen, the contour of her abdomen is normal. I'm going to go ahead and listen to her, all 4 quadrants of her bowels. So normally you would listen for 2 to 5 minutes in every quadrant, but for the sake of the video, I'm just going to say she has vowel tones present in all quadrants. While I'm here, I'm going to listen over Melanie's aorta. Good, and then I'm listening over her renal arteries, just looking for, assessing for any bruits. Vowel tones are real deal. Nothing heard over her renal arteries, so I'm going to the iliac arteries. I don't hear any bruits. And then the femoral arteries. Don't hear any bruits. Good. Okay, so we would do some palpation next. We start with light palpation, just asking Melanie if she has any tenderness. Obviously I would proceed with caution. She says no. Everything feels nice, soft. I don't feel any lumps or other lesions. So I would move on to deep palpation. Oh, and I could, I'm trying to think if I'm supposed to percuss or palpate first, I don't know. But the liver, I could palpate all over her abdomen. Should hear tympani throughout, predominantly I should say, and I do. So, so that's good. So I'm going to go ahead and palpate her liver, which should be under her right rib. It's hard for me to get way under there. We'll just say it's there. I would do the same thing over here for the spleen. Sorry, Mel. And then you could even go a little lower and lift for the, to palpate the kidneys. Okay, sorry, I'm really not so good at that. Okay, so abdomen. Oh, and then I could have Melanie just raise her head slightly and note her abdominal muscles, and they're strong, and they do pop up a little bit when she puts her head up. So that is good. Trying to think what else I'm supposed to do. I think I go on to legs now. I'll just make sure I can see your legs in the video, Mel.
Okay.
I can. Okay. So, looking at Melanie's legs, she has a normal hair distribution. Her legs are free of edema. They're warm, they're dry, the color is normal. I don't see any suspicious moles. I would come down and feel her pulses. Her dorsalis pedis pulses are nice and strong. Her tibial pulses are also strong. And then her popliteal pulses, let's see if I can get those. Those ones are strong too. I forgot to feel your brachial pulses before, sorry.
Yeah.
I forgot to feel Melanie's brachial pulses when I did her radial pulses. I better make, oops, sorry, I didn't mean to scratch you. Better make sure they're nice and strong. Oh yeah, they're very good. Oh my gosh, and I forgot to look at your nails. So Melanie's nails are smooth. There's no clubbing or brittleness or separation of the nail from the plates. So that's good. Sorry, I'm not doing very good at remembering everything. Okay, so what else can we say about the legs? I guess I could do your reflexes, Mel. Let me get my reflex hammer. So we're just going to do, I'll have you sit up again, Mel. We're just going to do the patellar reflex. I don't know how well this will work. Yeah. Okay, good. How did it work? No. So then, maybe you could sit on this.
Oh yeah.
Put it kind of more in the front.
Yeah.
Of your, there we go. Okay. I'm gonna try to do. Oh, good. You did have a little flinch there. This is the Achilles reflex. Oops. No, not working on that one. Or maybe I'll go like this, because then I can feel you. And then her brachial reflexes
I
here.
hear that.
Just let your arm,
Okay.
yeah. So I'm not very good at. Here, I'll go like this. I'm gonna hit my own thumb. Oops. Oh!
You got it.
And then I don't think we have to do this for the video, but. I don't think we have to do that one for the video, just the brachioradialis thing, which I'm not very good at. Oh, sorry, it's really, really deep. Let's see if we
Let me hard. Let me hard.
Great. Okay, so what else? We do musculoskeletal. Okay, so let's do like grips. Sorry, my hands are really sweaty. Okay, so grip my fingers. Good. Pull them towards you. Push away. Good. Okay, so try to move my hands forward as far as you can. Good. Okay, now pull my hands back. Good. Okay, so, and we did the shoulders. Melanie's strength is equal bilaterally. We can have her stand up and I'll check her, do you have full range of motion of your
Oh yeah.
neck? Okay, good. So she has nice range of motion, and then I'll just check her spine when she bends over and see that everything is nice and straight. And it is. She obviously has good balance and good strength. Good job, Mel.
Thanks.
I think that concludes my video. Hopefully I didn't forget a bunch of things. Thank you, Melanie, for being my
Thanks, yeah,
patient.
thank you.